Welcome. My name is Jasmine Kamboj, and I'm a medical oncologist and hematologist in the state of Minnesota and your host for the day. Empowering Oncologists is a podcast brought to you by OncoDaily, where we will focus on day-to-day concerns of an oncologist's being and workflow with a vision to find sustainable solutions. Before we dive in, a disclaimer. The views shared on the podcast are an individual's and in no way are contributions from any institution, organization, or guidelines. For our session today, we have Dr. Cheedella Naga, lovingly known as Suchi by her family and friends, who serves as an associate professor at the Texas Tech University Health Sciences Center, Lubbock, Texas. She is also the director of drug development and co-director of GI Oncology at her program. When not working, she loves to travel to beaches and does dance fitness classes. Dr. Naga, welcome and thank you for being here.
Thank you, Jasmine, for having me. And I'm very excited to be part of this podcast.
Wonderful. Thank you for being here. Suchi, please share with us about your journey. You've come long ways, from India to here and New York and now in Texas. Please share about your journey.
I think if I say a little bit about my background, I trained in India, and after that I did my residency and fellowship in New York. And after finishing fellowship, I came to Texas following my husband in Dallas, and I practiced at UT Southwestern and UT San Antonio in academics. And then I transitioned to phase 1 clinical trials in a private practice setting. We did phase 1A, the dose escalation studies. And after that, from July, I'm working at Texas Tech with all this experience, I would say. Drug development, private practice, academic practice. I'm the director of drug development program and the co-director for GI oncology program. So one thing I've learned all these years is that when you practice in one institute, it's very different in other institute, right? So in UT Southwestern, we had a quality improvement project where we incorporated nutrition in the GI oncology clinics. And we use the PDSA, the ASCO model, the plan, do, study, and act model.
Okay.
And we are trying to incorporate the same model to integrate the palliative care in our GI oncology clinics right now. So it is in the starting process of the plan.
Yeah.
So I'll keep you updated once we go to the do, study, and act process.
For sure. That sounds fascinating, Suchi. And I have a couple of follow-up questions on that. I'm sorry. But when we hear about private practice, all we think is it's seeing patients. Drug development or phase 1 clinical trials in a private practice. Please share some insights, like how did you get into those things in a clinical or in a private practice kind of a setting?
I think it was a unique opportunity for me because I was in academics and private practice with the phase 1 clinic is a very different world.
Yeah.
And but I practiced with a great referral source, Texas Oncology. I was a part of Texas Oncology. So I think that made me learn different aspect of practice, right? I would say Texas Oncology is like academic practice with a big base, and it's a very different place to practice. And we have seen patients, and it's a teamwork, and they have processes and logistics in place already, and that helps us a lot.
Yeah.
They have a research team which screens the patients, and if it is a qualifying trial, they refer to us. I think that is most important thing in any clinical trial place because we don't know which patient requires a trial.
Right.
And especially with the phase 1, you don't know whether there is a targeted drug. For example, there's an MTAB drug, right? And there is a start for the patient. The research team and having the village to do that, I think it's a very rewarding experience, I would say, and I learned a lot in the last 2 years. And I think with that experience, I think we are trying to develop a drug development program, which is like a comprehensive program in West Texas because West Texas has a lot of unmet need for clinical trials for the patients, and they have a lot of potential too, because we have Texas Tech researchers, and we are trying to incorporate the translational research and the industry-based clinical trials and try to develop the program with all our experience from both academics, private, and big cities, and as well as small cities like Lubbock.
Yeah. Wow. That seems like a dream come true, I think, because, as you said, there are so many great points in what you just described, Dr. Naga, because we all want to do research and clinical trials, but we're so overwhelmed in our clinical schedules that we don't have that time frame available to us. And so to have that research infrastructure and staff and, village, as you mentioned, of a team of people who support us in the background for doing research and enrollment on clinical trials, I think that is the key here. So thank you for sharing that. Suchi, you presented at the ASCO Voices last year, and you mentioned, obviously you shared a fascinating, wonderful patient story. So thank you for that. But you shared with us a spa technique, which is not the spa that we routinely think about. So please talk to us. What does the spa technique means, and how did you use that for your patient?
I think for me, spa technique is a tool, like the AI tools we use in my day-to-day practice. So what I call spa is stop, process, and act. So this all came together because of one experience with a patient. As we encountered in every day, right? I had a stage 4 cancer patient in my clinic, and I was explaining her the clinical trials, the data, information, and everything as we do with our patients.
Right.
And she paused and asked me one question. Can you send me to palliative care? So that was my stop moment. And I asked her why. She said, because one of my friend had terrible side effects from chemotherapy. She had breast cancer. And I don't want to go through that. I'm scared. So then I processed the question and acted on it. And act is explaining the patient what the chemotherapy does to her, what are the potential side effects.
Right.
And the most important thing is her cancer is very different from the cancer her friend had.
Absolutely.
Yeah. And also she qualified for a clinical trial.
Yeah.
And 1 year down the line, the sick patient had a smile and response.
Aw.
Yeah.
What a great story.
I mean, these stories happen every day in our life, everyday clinic, but we don't take so much focus and attention to those moments, right? But this moment made me realize that oncology is never about just treating patients or just managing the cancer.
Right.
It's about living life for the patient.
Oh,
that's why I use the spa technique every time when attack is down.
So beautifully articulated, Suchi. It's like, fortunately, we are living in times where we do have a lot of options for our patients. Not all the time, but majority of the times. And it's so easy to get overwhelmed, right? Because there's so many options and and so it is so important that we as providers and physicians step back and pause ourselves and then encourage our patients to pause themselves and take their time to make that decision. So it is so useful in day-to-day clinical practice for our patients and for us too. So thank you for sharing that. And I do agree with you that we do have rewarding celebratory moments every day in our clinics. And I guess we are not doing a good job in celebrating those moments, maybe again because of the paucity of time, and we should do a better job. So thank you for sharing. Dr. Naga, one of the lesser taught things in oncology is the caregiver burden. I, for one, say that cancer is not an individual disease. I think it's a familial disease because the individual who is going through the cancer, the rest of their family, definitely the spouses and the immediate family members, are living through that cancer journey also. Tell us about your thoughts around caregiver burden and how have you implemented AI and your GI Navigator program around that?
So I think I agree with you, Jasmine, because this is the less talked about. And when we see a patient in the clinic, the whole 30 minutes or the 1 hour with the patient, we spend on talking about the treatment, the prognosis, and the data, right? We never think about the logistics. I had one patient ask me, like, my son has graduation next week. I cannot travel now.
Yeah.
So small things in life, the logistics, right? So I think the most important thing is, which helped us in Texas Tech, is the GI Navigator program.
Okay.
Because we had the breast navigation, but we never had a GI Navigator. So one of the best asset I have right now is my nurse, GI Navigator. I think she has established herself as a part of the journey with the patients. And she's with them from the first step. She explains them what are the different types of treatments, right? Especially when we talk about chemotherapy, radiation, some of them don't understand the logistics and the types of treatment. And she's with them through all the finances. And she's a part of their family. And because of her, because of that asset, I'm able to decrease the caregiver burden, I think. And I think one of the term I coined is a caregiver bank. So it's like a similar to the patient bank. So with the have to have number of us, right? From family and friends, like for logistics, for travel, for finances. And I see that logging into the support groups like in social media, the Facebook, helps the caregivers a lot too.
Yeah.
And the last thing I would say, the AI tools you were talking about, there are a number of tools which are in development and in the process where the caregivers can access into the support groups and get information and either beyond the chat GPT we use. And also one more thing I have noticed that they help the patients and the caregivers to write and appeal for insurance denials too. So using these tools helps the caregivers to decrease their burden, right? Because all of us have only 24 hours in a day, and they have life, they have their work, they have their everything going on. The logistics have to be planned. And the other thing I tell them all the time is delegate. Don't think you are the only caregiver, and tap into that caregiver bank for help.
That is such a cool concept about the caregiver bank. And again, several great points here. Sometimes we are just busy like focusing on the treatment part and not working around, what actually matters. I recently had a patient in my clinic who had a terrible pneumonia and was sitting in my clinic to get started with her next treatment. And as I was talking to her, this was my first time visiting with her. I was covering for someone. As I was talking to her, I found out that next week was her son's wedding. Like an actual wedding in the house. I'm like, what? I think we need to hold for at least 10 days so you can have a good time at your kid's wedding and go from there. And she was very happy that we did that. So I so agree with you that these things matter and we need to pay attention to logistics. And the caregiver bank idea is fantastic. Thank you, Suchi. Talking about AI, let's talk more about that. You have trained yourself in artificial intelligence by none other than MIT, and you've been advisor to some of the AI startup companies. Tell us, how did you get into AI and what was your experience as an advisor to these startup companies?
I think I'm still in the learn. I would say I am still in the learning process. As my kid would say, I'm in the kindergarten in AI. And it's very fascinating journey though, because I always pride myself as other oncologists as a data-driven person. I'm fascinated by numbers from the start.
Yeah.
So this all started when I read a report on CARES on the next generation sequencing, where I saw a recommendation on FullFox AI. So I was talking with my husband and I didn't understand everything, how the data was generated and what is the recommendation and what is the interpretation as an end user to me. Then I started learning about it and I took a course in MIT in healthcare. And my journey started from that. And I usually learn by writing and learning about it. So I started writing a chapter. I authored a book in AI healthcare. And it was a task-making journey where I really learned about the potential and the bias and the disparity in AI. So right now, I would say my engagement with AI can be summarized in 4 words. Data, disparities, decision-making, and digital twins. I think I divide AI into two categories. One is AI, which helps for my critical thinking, and the second AI, which decreases my administrative burden. Like we use the scribes, like for the clinic flow and monitoring the side effects of the patient. They decrease the administrative burden.
Right.
And the second AI I'm focused on is developing tools for decision making for the patients. This is for the critical thinking. And I'm more skeptical and more cautious about critical thinking AI than the administrative burden AI. Because as we all know, it all depends on the data, where the AI is trained from. If they don't include older patients or younger patients, and it is not representative of the whole population, then AI will lead to healthcare disparities, right?
Right.
That's the most important thing we have to focus on.
Absolutely.
And the second thing, there was a study on melanoma where the AI was trained on the lighter skin patients to detect melanoma. It cannot be representative of darker skin patients. So we have to be careful and be educated about the data sets too first. Yeah. And the second thing, I think the disparities we talked about. And third thing is I want AI to help me to make decisions for my patients, the digital twins.
Right.
Most of the trials don't use older patients, right? And they don't incorporate, and the data is not representative of the patient sitting there.
Absolutely.
It can use data like 30% respond, 40% respond. But what does to my patient sitting there, I can we need AI tool for that.
Yeah.
And the digital twin technology for that, I think, is very useful.
Absolutely.
And the last thing I would say is one of the study I read recently, by my colleague, about de-skilling the physicians. The amount of AI the physicians use, and it has reduced the skill of the physician, should not change the critical thinking of the patient. That's most important. The AI oncologists. I have pets who use AI tools more than I do in the clinic. Can learn AI can hallucinate, and the data sets are different.
Right.
Educated is very, I think, the most important thing, how to use it, how to interpret it, and the data they trade on.
For sure. For sure. No, all of those are such fascinating points. And I feel like all of these organizations like ASCO and COA and others are really trying to invest time and energy and effort into this space, and it is so needed. I think Dr. Doug Flora just came up with his book on AI, and I have to read that. So, yeah, thank you for all the great work you're doing, Suchi.
And I think I would add one more thing is that I'm really excited to be part and have the privilege of working with you in ASCO Community of Oncology for AI policy, because this is most important thing right now.
Thank you. Suchi, moving on to our trainees and early career oncologists, one advice you would give to them they can learn from your experience and journey?
I think one advice is like things have changed so much. When I trained, I think I had one drug for liver cancer, and now we have so many.
Yeah.
And it's the liver cancer too. One thing I would tell them is like oncology is ever changing, and you have to have your focus.
Right.
What you're going to do, how do you want to do, and how to use the tools, right?
Right.
We didn't have so many tools when we practiced and trained.
Absolutely.
So I think that most important thing for the upcoming oncologists to focus first on the goals, tools, and career paths, and have mentors. That's the most important thing which I didn't do.
Right. Do you have a mentor now, Suchi?
I think I wouldn't say direct mentorship, but I think learning from everyone.
Yeah.
My chair is a great mentor in leadership. And I've been learning so many people like you too. You are a mentor too for me. And then like so many people have been there, and I can learn from them. And one more thing is like we have a group in Dallas, Dynamo Docs, and they're not oncologists, they're all physicians. But we share and teach each other about everything, like fitness, about how to maintain quality of life, how to improve ourselves, and how to use tools.
Right.
And also about financial literacy, which I never had. They teach me.
Yes.
So I think that helps a lot when you have a village and a group who supports you and teaches you kind ways.
That is so nice that you bring up that point that your village doesn't only have to be an oncology village, right? It can be way beyond that. In fact, I feel like it's high time that we start building relationships and form these collaborations outside of oncology world so we learn from them and they just bring a different color to us, right? Like other medicine people and even non-medicine people, there's so much like interesting stories that come out of talking to all these different diverse groups of people. And it is so well said that, as we are training in our training programs, we are so busy that our goals are finish residency and finish fellowship and finish this and that. And for immigrants, it's also like finish J1 waiver or whatever your visa situation is. But at the same time, it is so important that in the parallel, we focus on relationship building and form our, group of friends and village, as you said, because ultimately we need to kind of, bank on them for our future growth, both personally and professionally. So that is well said. Thank you.
And I would add, like Jasmine, same thing, because I was talking to a palliative care physician and she has similar experience as me, right? So when she writes a lot and I'm a bit inspired from her to write. But I think what I learned from them is they have the same experiences as we do in everyday oncology practice.
Right. Absolutely. 100%. And I feel like sometimes when we are so tunnel visioned into our world, we fail to recognize that there are so many challenges that others around us are having too. So it makes us more compassionate when we talk to others and learn about their challenges and their workflows, etc. It's fascinating. So thank you for sharing that. Suchi, one advice you would give to yourself of 10 years ago?
I think I would tell myself to focus on myself because that's the thing you were talking about. We never think about self-care. And I told my nurse one day that we cannot pour from an empty cup.
Absolutely.
And as an oncologist, we have to share and we have to take care of ourselves.
Absolutely.
And the other thing I would tell myself is the most important thing is saying yes. I wouldn't have said yes to podcasts or anything or the roles I'm doing right now 10 years back. So that I would tell myself to say yes on the time.
There's a lot of power in saying yes, right? Sometimes you don't know what you're getting into, but I would say that it brings new experiences.
I know.
Wonderful. On to a little bit of rapid fire about you, Dr. Naga. Your favorite book?
I think I would say a blog because I think during my fellowship, just when I finished my fellowship in 2013, I think there was a blog on the power of words about discussing decision making and prognosis. I think it was at 2013. So I think it inspired me to think about decision making as an important thing in my day-to-day practice.
For sure.
And the other thing I started reading and I really liked it, the Thinking Fast and Slow. Now I'm reading it. So it's my favorite book, I would say.
Oh, thank you. Your favorite leader, Suchi?
I mean, I'm in GI oncology and translational research. I think one of my favorite leader or inspiration, I would say, is Dr. Daniel Von Hoff.
Okay.
Yeah. I really admired him, what he did in the field of oncology, in pancreatic and drug development.
Very nice. Very nice. Your favorite non-GI study, Suchi?
I think most of us have that moment, right?
Yeah.
The revolution, the Gleevec movement.
Yes.
That changed oncology forever for everyone.
Yeah.
And one of the things I take it from Gleevec movement is to increase the quality of life, the most important. Lesser side effects, more quality of life, more response.
Sure. Yeah, absolutely.
I want to incorporate AI in that and make another revolution.
Yeah.
Right from the Gleevec.
Wonderful. Yeah. No, it definitely changed. I think when we were medical students, I think CML was deemed to be like a fatal disease, right? That's what I studied as a medical student. But then now, thanks to all the TKIs, it's amazing to see that. Your favorite restaurant in New York or Dallas?
I like Butakan, which is an Asian cuisine.
Okay.
Yeah. In Dallas, it's a food hub.
Okay.
So there are so many restaurants I like.
Yeah. Yeah.
And I'm still exploring Lubbock, so I'll
For
keep you
sure.
posted on that.
Beautiful. What kind of dance do you like, Suchi?
So I was talking about the Dynamo dogs, right? We have a neurologist. She does a poly fitness class, which is a combination of Zumba
Okay.
and volume dance. So
Okay.
I think that's one of my favorite routine
Yeah.
right now.
Oh, wonderful. Does your son participate in any of the dances with you too?
I think he doesn't like the formal training of
Uh-huh.
dance,
Yeah.
but he has to dance.
Yeah.
Yes.
Lovely. Lovely. Fun fact about you. You are in love with two warm things. Please share with us what are those.
I think sunshine
Mm-hmm.
and a warm cup of coffee.
Mm-hmm.
I think those are my favorite things.
Mm-hmm.
And my clinic always knows about it. And then
Mm-hmm.
my nurse is ready with a cup of coffee for me. So,
Aw. Isn't
yeah.
it amazing how these little things make us so happy? Like just a warm cup of coffee. And I'm the kind of person who's always cold, and sometimes my nurse will like bring like a warm blanket for me.
I think coffee does that for me. So,
It's it's so sweet, like oh my gosh. All right, Suchi, last question for you. If you were to relive your life, would you become an oncologist and why?
yes. I mean, I think 100% would be less when I say that. It would be like 1000% or more than that. Because I always talked about being an oncologist. It is so rewarding at the end of the day. And we change lives in a manner which is very different from any other physicians, I will say.
Right.
I'll tell you about a patient when I spoke about her in Ask Our Voices.
Mm-hmm.
So this was during my training, and she wanted to talk to me. And she was almost in the ICU, but she just wanted to thank me at that moment.
Oh.
And those movements are like, you've never experienced those. And it strengthened my endeavor
Right.
to change things for my patients, right?
Right.
So we always think about the success stories, the rewards, but sometimes these moments where nothing happened what I wanted.
Yeah.
But she said, this is all I need. I just want to say thank you to you for being there. So I think combination of those rewards and those moments, I think make the oncologist very detective person. And it's very rewarding.
Wonderful. Wonderful. Thank you for sharing all of that. All right. So, the three key takeaways for the oncology community from our conversation with Dr. Cheedella Naga. Folks, build your own supportive network, which could be, outside of oncology, outside of medicine. Dr. Naga has a village. She likes to call them the Dynamo Docs. There's a lot more to learn about life besides our work, beyond our work, like finances, your fitness programs, your music, your retirement planning, just kind of like nurturing your soul and your well-being and yourself. Because as she said, you cannot pour from an empty cup. So you have to invest in yourself and in your network and your self-care. The second point is apply the SPA technique, which is, taking a moment and pausing and then taking an action. This is not just for the patient's, decision making. It is also our own lives. Actually, you could apply this a lot while you're taking care of your children, especially if they're younger and teenagers, because there's a lot of questions they ask you at odd moments. And the last thing is that when we are implementing cancer care strategies or treatment planning for our patients, it is very important. It is critical that we pay attention to the logistics of that management and to their family members who are their immediate caretakers, because the caretaker burden is indeed lesser talked about issue in oncology. And hopefully, with the help of our navigator colleagues and hopefully with the help of AI, we have better care for the caretakers who are taking care of our cancer patients. So that is all for today. Thank you to our viewers and listeners. Thank you, Dr. Naga. This is Jasmine Kamboj and Dr. Cheedella Naga signing off on behalf of OncoDaily from our conversation on Empowering Oncologists. And now we have an Empowering Oncologist playlist on YouTube. Don't miss an episode and stay tuned. Thank you so much.
Thank you, Jasmine.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.